For the next installment in our series on collaborative practice agreements, we'd like to focus on the physician perspective. Maybe you've heard of collaborative practice agreements, or maybe you've worked closely with pharmacists in the past and you want to make sure you're operating at the optimal level with him or her. CPAs are a relatively new concept, especially in Kansas, but how are they being received by the medical community? To review, a collaborative practice agreement, or CPA, is a written agreement between a physician and a pharmacist. Under the agreement, the physician may refer a patient to a pharmacist to manage routine drug-based care for a pre-specified disease. The doctor and the pharmacist agree upon a protocol for the pharmacist to make changes to a patient's medications based on how the patient is responding to treatment, and the pharmacist communicates these changes back to the doctor within 48 hours. If events or complications arise that fall outside the protocol, the pharmacist simply refers the patient back to the physician. Pharmacists tend to highly value the opportunity for increased patient engagement, as well as the opportunity to practice at the top of their license, but how do physicians operating under a CPA feel about them? According to a survey of physicians in the Indian Health Service National Clinical Pharmacy Specialist Program, the reception of CPAs has been positive. According to the survey, 88% of physicians indicated that collaborative practice with pharmacists in their facilities helped them to improve health system outcomes. 77% reported reductions in complications of therapy. 75% reported that the pharmacist-based primary care clinics increased patient access to care and improved disease outcomes, and 82% noted a decreased workload, which allowed them more time to spend with critically ill patients. The decrease in workload comes primarily from the removal of certain administrative aspects of pharmacy care, such as responding to prior authorization requests and updating patient records. The pharmacists were also able to facilitate regular follow-up for disease management and lab monitoring, and to take on some prescriptive authority. Let's hear from a physician in Wichita, Kansas, who's operating under a collaborative practice agreement, Dr. Joe Spurlock. Dr. Spurlock is the Chief Medical Officer for Harry Hines Hospice. As with all hospice facilities, Harry Hines receives capitated reimbursement for patient care, so it is in their best interest to keep their operating costs as low as possible while taking up as little of Dr. Spurlock's time as possible. One way they've gone about this is to implement a collaborative practice agreement. We'll let Dr. Spurlock explain their process.
So since my patients are generally still seeing their primary care physician regularly and I function as a co-attending with them, our case is interesting in hospice in that we provide a lot of the functionality related to the med delivery system. We are expected to both prescribe in many cases and certainly dispense the medications through our central pharmacy or an affiliated pharmacy that the hospice is having a direct relationship with. The benefit that is derived from this is that when I prescribe a medication to a patient, I know which pharmacist it's going to be going to, and in many cases I also know where the medication is going to be coming from. So this allows a lot of edge case in terms of being a closed loop, which is a little different perhaps than some of the other general primary care cases may be. The advantage being that I know that a pharmacist that knows palliative medicine is going to be involved in the decision making. Therefore, I feel comfortable having a collaborative practice agreement with that pharmacist to be able to help the nurses coordinate the orders, make sure that the orders are good, appropriate, check for interactions, all of the usual things, as well as being able to allow them to go ahead and titrate doses, start certain medications, or obviously operate under a protocol where we can have advantages of both a one-stop shop for the nurse when she needs to get that medication ordered and dispensed, as well as a filter for someone that can think as well as I can about the safety, interactions, and even better than I can about cost effectiveness. And so this is one of the big advantages of our system.
While a reduced burden on the physician is a significant benefit to implementing a CPA, there are many other benefits as well. According to a report to the Surgeon General, studies have shown that collaborative practice agreements really did improve patient outcomes, decrease costs to the patient and to the health system, and improve the patient experience. Improvement in patient outcomes came in the forms of diabetes, hypertension, and dyslipidemia management, among others. Studies show a significant improvement in hemoglobin A1C levels in diabetic patients, systolic blood pressure levels in hypertensive patients, and reductions in LDL and total cholesterol levels in patients with high cholesterol. Pharmacists have also been shown to contain or reduce healthcare costs. Savings have been realized with a reduction in clinical events, such as hospitalizations and emergency room visits, but have also reduced outpatient visits, shown cost savings to healthcare institutions, health plans, and direct costs to the patient, as well as fewer missed or non-productive days. As noted in the Asheville project, direct medical costs decreased by $1,200 per patient per year, and an estimated annual increase in productivity of $18,000 was seen due to a reduction in sick time. Patient satisfaction scores also increased in several studies. This is the third in a series of videos on collaborative practice agreements. To view other videos in the series, see sample CPAs, and contact Health ICT, visit our website, healthict.org/healthcare-providers. For past videos, see the Health ICT YouTube channel or the links below. Health ICT is available to provide free technical assistance to any providers interested in developing and implementing their own CPA. Thanks for watching.